Medical field is transforming with several ways of treatments. However, homeopathy maintains its importance and effectiveness. Unique features like targeting the root cause of disease with providing complete cure for the patient is something that has been the reason of homeopathy's popularity even today. Due to increasing awareness, a large number of patients are opting for homeopathy, from the common man to the elite class. Experts of homeopathy, on the basis of their research and meticulous and sincere efforts to help patients get remedy, are not only finding solutions for several serious chronic diseases and helping patients live a normal and healthy life, but also creating large-scale public awareness about this treatment. Dr. Vijay Kumar Mane, one of the most reputed homeopathy practitioners of the world and the founder and CEO of modern homeopathy, has been practicing for more than 2 decades and has been successfully curing numerous patients with serious and chronic diseases through his extensive research and innovative treatment methods. He is also helping patients to regain self-confidence and live a happy and healthy life. Dr. Vijay Kumar Mane started his medical career as a lecturer and did extensive researches on traditional treatment therapy and invented simple curative line of treatment named modern homeopathy for several incurable diseases and gave relief to numerous patients. His journey began around 1998 from Kolhapur and steadily it spread to other parts of Maharashtra as well. Soon, patients from other states of India as well as patients from around the world started visiting him and consulting him for his treatment. No doubt, his innovative ways soon proved beneficiary for the patients. Modern homeopathy's curative line of treatment has come into existence through thorough research, vast experience, and a huge database of successful case histories of patients of Dr. Vijay Kumar Mane. His continuous efforts to excel and steadfast research for further innovations, searching solutions for the patients with the most complicated symptoms have been the reason for his success. Dr. Mane is continuously working towards inventing new, effective treatments and innovative medicines of various serious and pathologically advanced diseases like cancer, kidney failure, liver cirrhosis, diabetes, asthma, arthritis, and other incurable diseases. Modern homeopathy is also designed to manufacture and produce medicines formulated and innovated by Dr. Mane. Medicines which are found both in liquid form and in globules and are easily consumable and highly result-oriented.
Hello, I'm Dr. Mrunmayee and welcome to your favorite health series, Healthy Era with Modern Homeopathy. In last few years, the prevalence of cancer has increased to a great extent. And we all, especially we ladies, are really worried about it because different types of cancers are coming up. For ovarian cancer, what treatment we have in modern homeopathy? Let's talk about it. I'm glad that today we have with us CEO of Modern Homeopathy, Dr. Vijay Kumar Mane. Hello, sir.
Hello.
Welcome to this show.
Hi.
So when we talk about cancer, what exactly the cancer is?
Cancer is nothing but excessive, abnormal, uncontrolled growth. It can happen anywhere in the body, in any organ.
Okay. And when we talk about ovarian cancer, we will be speaking about ovarian cancer. But first, I would like to know about the importance of ovaries in female body.
Ovaries are very important for the reproduction. Ovaries situated on both sides of uterus and held by a thin membrane or fallopian tubes. Ovaries reproduces the cells or eggs in the ovaries, and these are very important for reproduction of humans.
Then when we speak about ovarian cancer, is there any particular age group?
In India, we have seen that age group of more than 45 years, these are more prone to ovarian cancer.
Is it related to menopausal period?
Yes, it is related to menopausal period also, and other factors also included as causative factors.
What signs and symptoms we can see?
First, we can see the causative factors of ovarian cancer. As we know, the causative factors includes the women who have no children, sterile or infertile women, then women undergone hormonal therapies
Okay.
for menstrual complaints, women undergone androgenic treatments. Today, we have seen that most of the cattle are injected with milk producing agents or hormonal drugs. That can be a causative factor.
Okay.
Consumption of such milk can be a cause for ovarian cancer or breast cancer also.
Nowadays, we see that many women are taking hormonal treatments.
Yes. Hormonal treatment is very common.
How safe it is?
I think oral contraceptive treatment is also not safe for women. That it can be a causative factor in ovarian cancers as well as in breast cancer also.
So, as you mentioned, oral contraceptives. Nowadays, oral contraceptives are readily used and they are available over the counter also. So, are really women aware about these factors?
No, most of the women are not aware about these factors. So, one should try to avoid all these things.
And what are the signs and symptoms we can see in this cancer?
Signs of symptoms in ovarian cancer depends on stage of ovarian cancer.
Okay.
At early, there will be no sign and no symptom. When the disease shows full-blown picture of ovarian cancer, then symptom may be a swelling of abdomen, uneasiness, nausea, vomiting, or pain in abdomen. So these are very common or vague symptoms.
And we have a tendency, women have tendency to, just
Yes,
ignore
to
all
hide,
these.
ignore and to hide. Tendency to hide is more important in India.
Yes. So, what will you advise to all the women, especially in this age group after 45?
In menopausal age group, women should be more, should know about this grave disease, and they should aware of. There should be a campaign of awareness in women of menopausal age.
How do we diagnose that this is a ovarian cancer?
We can diagnose with help of MRI abdomen and pelvis or CT scan of abdomen and pelvis. It can show the growth inside the ovaries, one or in both ovaries. And a few blood tests are there. CA 19.9 is the test which can show if the levels are high, that may be a sign of ovarian cancer.
Can we detect this ovarian cancer in sonography?
Yes, we can detect in sonography. If the tumor is more than 2 or 3 centimeter, then it can be detectable with the sonography. And also with the sonography, we can do CA 19.9 test, that is the blood test.
So, can women do all few tests which can be done by women routinely?
No, there are no such routine tests. The test, as I have told earlier, sonography is the primary diagnostic tool.
Okay.
And later CT scan or MRI abdomen and pelvis.
So, what kind of conventional treatment we have for ovarian cancer today?
Conventional treatment include surgery followed by or chemotherapy, or before chemotherapy followed by surgery and later followed by chemotherapy. That is the only conventional treatment available yet, but it is not very much successful. Patient of ovarian cancer may end with chemotherapy.
And are there any complications of ovarian cancer?
Complications may include spread to other organs like chest, sometimes in brain.
Oh.
These are the complications, and chances of recurrence are more in case of ovarian cancer.
Recurrence is very common.
Most of the times it happens that it had been seen that the cancer, ovarian cancer, usually when it is diagnosed, it has spread all over the abdominal cavity, on intestines, and in all other abdominal organs.
So, if a woman comes at this stage to take treatment with modern homeopathy, can we do something about it?
Yes, we can treat ovarian cancer also. It will be better if a patient comes to us before any conventional treatment, before any chemotherapy or surgery. That will be more better.
And how does homeopathy works in these kind of patients?
As I said earlier, homeopathy, we have research work in modern homeopathy that pathological changes are reversible under the modern homeopathic regime. And the modern homeopathic treatment is immunomodulator. it can increases immunity, and the immune system of body can fight with the cancer.
Okay, sir. So basically, we have so many things to know more about ovarian cancer and also about modern homeopathy. We will be talking about it right after the break. Welcome back after the break. You're watching your favorite health series, Healthy Era with Modern Homeopathy. 38-year woman Anita Boy from Aurangabad, Maharashtra was diagnosed with recurrent metastatic ovarian cancer. She opted for modern homeopathy. Let's see her reports and what she says about it.
Anita Boy, 38, was suffering from persistent abdominal pain and fever in February 2015. The sonography report showed a tumor in her ovaries. Experts report that the tumor is cancerous. The knot was as big as 6.2 to 5.3 centimeter.
माझं पोट वगैरे दुखायचं, मग आम्ही सोनोग्राफी वगैरे केली. मग त्याच्यात रिपोर्टमध्ये आलं का गर्भाशयाला गाठ आहे. मग ते ऑपरेशन करून काढली 2015 मध्ये.
In March 2015, she underwent surgery to remove the tumor and underwent 2 chemotherapy. For 1 year, her health was stable, but after 1 year, she started suffering again.
केमो घेतल्यानंतर परत थोडे दिवस आराम पडला, मग परत त्रास जाणवायला लागला.
Her weakness had increased and she lost weight. She had a hemoglobin level of 7.5 and a low platelet count of 27,000 only. Experts said her illness had spread to the liver. She underwent uterine surgery in October 2016, but unfortunately it made no difference at all.
पुन्हा ऑक्टोबर 2016 पुन्हा गर्भाशयाचं आणि गाठचं ऑपरेशन झालं. नंतर हळूहळू ते थोडं 2 महिने व्यवस्थित वाढल्यानंतर लिव्हरमध्ये जंतू पसरले.
Her illness continued to grow. In November 2016, she started modern homeopathy curative line of treatment.
न्यूजमध्ये ऐकायला भेटलं का मॉडर्न होमिओपॅथिकचं वाचलं होतं. त्याच्यामुळं मग ते माहिती मिळाल्यामुळं आम्ही पुण्याला गेलो. तिथे गेल्यानंतर सर विजयकुमार माने यांचा सल्ला घेतला. त्यांचे मेडिसिन घेतोय आणि त्याच्यानं आता रिपोर्ट एकदम नॉर्मल आहे.
Within 2 months of starting modern homeopathy curative line of treatment, she began to notice a difference. She started eating.
2 महिन्यामध्ये त्यांचं औषधाने आम्हाला चांगल्या प्रकारे उपचार जाणवलं. आज आमची मिसेसची तब्येत एकदम व्यवस्थित आहे.
As per the report dated 23rd August 2017, her illness has decreased and her anemia has reduced. She gained weight, her hemoglobin and platelets returned to normal.
ऑगस्ट 2017 मध्ये आम्ही जेव्हा सोनोग्राफी केली तेव्हा त्या सोनोग्राफीमध्ये असं निदर्शनास आलं की कॅन्सर हा आजार नॉर्मल स्थितीत जाणवलं आणि त्या औषधाचं कोणत्याही प्रकारे साईड इफेक्ट झालेली नाही.
सर विजयकुमार माने यांच्या औषधाने मला 2 महिन्यात पूर्णपणे आराम पडला. ज्यांना हा त्रास आहे त्यांनी सरांशी संपर्क साधावा व त्यांची भेट घ्या.
Mrs. Boy is currently living a normal and happy life with the modern homeopathy curative line of treatment.
As we saw, Anita Boy is now totally cured of her ovarian cancer. We will talk more about this case in details right after the break. Welcome back after the break. You're watching your favorite health series, Healthy Era with Modern Homeopathy. In previous segment, we saw experience of Mrs. Anita Boy. Now we want to know the details about this case. We will know it from Dr. Vijay Kumar Mane. Hello sir, and we are really curious to know about this particular case.
In November 2016, patient started modern homeopathic treatment. Within 2 months, patient feels better and fresh. Her appetite were improved. Scan of 23rd August 2019 shows improvement, weakness reduced, hemoglobin improved, there is weight gain, no evidence of cancer on imagination finding.
Okay.
Now with modern homeopathic treatment, patient Mrs. Boy living normal and healthy life.
So how long she was taking treatment?
As we have seen, near about 1 year, she 1.5 years she undergone the treatment.
Okay, so comparatively that is a small
Period. Yes, yes, yes,
and as you said that she had metastasis to liver.
yes,
So in many cases of cancer, we see metastasis to other organs,
yes,
which generally supposed to be uncontrollable and very difficult to treat.
yes.
So what is your experience in modern homeopathy?
Most of the time, under our modern homeopathic regime, we can control the disease. We can give additional life to the and healthy life to the patient. And most of the time, the patient may get cure under the regime of modern homeopathy if cases of recurrence like this, Mrs. Anita Boy, are there.
And in this particular case, the age of patient is also less than 40 years.
Yes, yes.
So in these cases, generally you said the prevalence is after 40 or 45.
It's a common notion, but sometimes patients with age less than 45 years also came with ovarian cancer or breast cancer. Nowadays, the chances of cancer are more increasing also in pubertal or pre-pubertal age also.
Oh, at puberty also.
Yes, yes, yes. Most of the time, the causative factor was family history of any ovarian or breast cancer, or if patient having some genetic mutations like BRCA1 or BRCA2 present, then in such cases, patient come with in early age patient come with ovarian or breast cancer.
Okay. As you mentioned family history, so if anybody is having family history of any kind of cancer, then that particular person or that particular female, should they take some extra care?
I suggest they can follow modern homeopathic regime for prevention of that particular cancer if there exists the family history.
So if family history is there and there are no symptoms right now, then also we can
Yes,
get.
we can suggest preventive treatment in such cases also.
Okay, and as we say, prevention is always
Yes,
better than cure. So this is really, you can say, a good news that if you have any family history of any kind of cancer, you can take preventive treatment from modern homeopathy. Sir, do they have any side effects?
No, under modern homeopathic treatment there are no side effects. Taking the drug is very simple. They can take the medicines through mouth. There is no need of hospitalization, and so the cost of the treatment is also very less in compare with conventional treatment.
Yes, and it is very traumatic also going through that treatment, going through chemotherapy, and radiotherapy. And especially for female, it is very painful to lose their hair.
Yes, yes.
So my question is, if the patient comes early before taking chemotherapy or radiotherapy,
That will be better. If patient comes early before taking chemotherapy, radiation or surgery sometimes, then the chances of cure are very much more.
chances of cure are much more, and I guess there would be early cure also.
Yes, yes, yes.
Okay. And generally, how the patients respond to modern homeopathy?
Generally, with the regime of modern homeopathic treatment, patient feel better within 15 days of treatment.
That's really great.
Yes.
Because generally it is considered that cancer is a chronic disease and you have to go through so many types of treatments.
Yes, and so many for treatment and for so many years.
What would you like to say to all women to avoid this kind of ovarian cancer?
I would like to say that women should avoid hormonal treatment for menstrual irregularities, then contraceptive pills, and I think government banned that drugs for cattle. They have giving for extra milk.
Excess milk.
Excess milk. And if there is any history of family history of ovarian cancer or breast cancer, then they should have consult us, modern homeopathy.
What kind of investigations we need to do for diagnosis of ovarian
Ovarian
cancer?
cancer. We need to do sonography at earlier, and if we suspect any tumor in ovaries, in single ovary or in both the ovaries, then we can do blood test like CA-125 and CT scan or MRI of abdomen and pelvis.
So today we saw reports and experience of Mrs. Anita Boy, and I think that is a proof that we can say yes, cancer can be cured with modern homeopathy. So thank you so much for being here today. So we conclude this episode with a hope, and when we choose hope, anything is possible. Here we take leave for today. Goodbye and take care.
Our address, Modern Homeopathy Research and Treatment Center, E Ward near Gita Temple, Kawalanaka, Kolhapur 416003. For counseling and guidance, contact at our centers below: Kolhapur, Dadar, Kalwa, Thane, Dhankawadi, Pune, Pimpri, Chinswar, Nashik, Aurangabad, Nagpur, Solapur, Goa, Madgaon and Mafsa, Karnataka, Bangalore and Hubli, Telangana, Hyderabad. For counseling and guidance, give missed call at 70388-33881. You can also contact us on 9730339009 or at 9372728009. Our toll-free number is 1800-121-8009. Our website www.modernhomeopathy.com. You can also email us at contact@modernhomeopathy.com.